It seems like every few months there's a new study about coffee. It's either good for you or really bad for you. Once again, the doctor is in. And Larry, we turn to you to explain the latest report about coffee and diabetes.
Heidi, this was a very interesting study because it showed that if you drank coffee 3 cups, at least 3 cups a day, it reduced your chance of diabetes by 10%. If you had 6 cups or more, it reduced it by 50% in men, maybe 40% in women. So it's almost like it's a health food. But when we think of coffee, it's just not the caffeine, it's other chemicals in the coffee, like other nutrients and chemicals that we are not yet identified. So for diabetes, it certainly looks like it's a beneficial beverage to reduce the incidence in diabetes.
Now, is there a difference in terms of benefit to the individual if they drink caffeinated versus decaffeinated coffee?
There is, because most of the studies have been done with caffeinated coffee. And when you take the caffeine out, you have to either soak the beans or you give a chemical to leach it out. And so there may be some problems with some of the leaching, but what you could say is that caffeinated coffee has a lot of benefits, and we may not see that in decaf. We just don't know. But some of the benefits are reduces the chance of Parkinsonism, reduces the incidence of Alzheimer's, reduces gout, gallbladder disease, it increases athletic performance, a host of other things. People were worried about cholesterol, and it seems like only if it's unfiltered coffee will the cholesterol rise. If it's filtered, it takes out some of the oils and...
Through the paper.
Paper, yeah, paper filter.
So this old percolator that used to cook the coffee on the stove is not a good idea.
Well, it's less of a good idea. I mean, it may taste better to you, but as far as raising your cholesterol, it may do it a little bit, but most people use filtered coffee these days. The other thing is, we thought it may cause high blood pressure, but that doesn't seem to be true. And we thought maybe it causes heart disease, but it seems to protect against heart disease. So the bottom line is coffee is safe for most of the people unless you're sensitive to the effects of the caffeine, where you get irregular heart rhythms, or you can't sleep at night, or you're irritable, you have insomnia. But in general, coffee is a safe beverage. And remember, there's a withdrawal effect from caffeine. Once you stop it, you may get headaches or irritability again.
Well, I love my coffee in the morning. I don't think that's going to happen.
And most of us do.
Thank you so much for joining us.
We look forward to seeing you the next time. I'm Dr. Larry Santora.
I'm Heidi Cortese.
And remember, your health matters.
Be well.